Let me ask you something personal. When was the last time you allowed yourself a piece of chocolate? Not a stolen bite, not a guilty one, but a real, relaxed, guilt-free piece of chocolate. If you're living with pre-diabetes or type 2 diabetes, my guess is it's been a long time, maybe years, and I need to tell you something today that I genuinely believe will shift how you see this disease. The idea that chocolate is your enemy, that it's the one food your blood sugar simply cannot tolerate, is not just outdated. In some cases, avoiding the right kind of chocolate has cost you a tool that could have been quietly working in your favor all along. There is a form of chocolate sitting on your grocery store shelf right now with a glycemic index of just 22. That is less than 1/3 of white bread, less than a bowl of instant oatmeal, less than a glass of orange juice, and compounds inside that chocolate have been documented in peer-reviewed clinical studies to improve insulin sensitivity, lower the inflammatory markers that keep diabetes progressing, and even support the regeneration of the cells in your pancreas responsible for producing insulin. The difference between the chocolate that harms you and the chocolate that helps you is written on the back of every package. It takes about 30 seconds to read. Today, I'm walking you through 5 specific types of chocolate that the evidence supports for people managing their blood sugar. Stay close to number 5. It is the cheapest of the 5 and carries the strongest clinical backing of all. Before I begin, I want to ask you a small favor. Drop a comment below and tell me how old you are and how long it's been since you turned down a piece of chocolate because you were afraid of what it would do to your blood sugar. I read every comment, and your answers genuinely shape what I cover on this channel. Now, before I name a single one of those 5 types, I need to give you something that almost no article about chocolate and diabetes ever bothers to explain. Because if you don't understand this first, everything that follows will feel like a random list. Once you understand it, every single one of these 5 will make complete biochemical sense. Here is the truth most people miss entirely. The benefit is not in chocolate. The benefit is in cacao. And those are 2 very different things. A mass-produced milk chocolate bar packed with refined sugar, hydrogenated vegetable oil, and almost no real cacao has very little in common with the cacao bean itself, except a borrowed flavor and a familiar color. The healing compounds live in the cacao. Industrial chocolate just uses its name. Cacao contains a concentrated group of plant compounds called flavonoids. The 2 that matter most for your blood sugar are catechin and epicatechin, and these compounds work on your diabetes through 3 specific mechanisms that I want you to understand clearly. The first is improving insulin sensitivity by repairing the lining of your blood vessels. Picture insulin resistance like a phone line full of static. Insulin is calling your cells. Glucose is standing at the door, ready to come inside. But the cell can't hear the signal anymore. It has gone quiet. The connection is broken. Cacao flavonoids work directly on that vessel lining, the endothelium, and help restore the signal so your cells can finally receive it properly again. The second mechanism is reducing oxidative stress. Cacao consistently ranks among the highest foods ever measured for antioxidant capacity, and oxidative stress isn't some vague abstract idea. It is one of the central reasons your insulin receptors stop functioning the way they should. Bring oxidative stress down, and those receptors begin working again. The third mechanism is the one that genuinely changed how I think about this food. Epicatechin, the most abundant flavonoid in cacao, has been shown in cellular studies to stimulate insulin secretion and support the regeneration of beta cells. Those are the cells in your pancreas that produce insulin. In type 2 diabetes, they wear down slowly over years. The idea that a food compound could help restore those cells, rather than simply compensate for losing them, is an entirely different kind of conversation. So when I walk you through the next 5 types, I'm not picking favorites. I'm ranking them by how much flavonoid they deliver, and how solid the clinical evidence is behind each one. Let's start with the one most of us can bring into our kitchen tonight. Dark chocolate with at least 70% cacao. I put this one first, not because it's the most powerful, it isn't, but because it's the most realistic place to begin. The flavor is firm but enjoyable. You can find it in any grocery store. The science behind it is solid enough that I have no hesitation recommending it as a starting point. Here are the numbers you need to know. 70% dark chocolate has a glycemic index of around 22. To put that in context, table sugar sits at 65. White bread is around 71. A banana is around 51. So a square of good dark chocolate produces a slow, gentle rise in blood sugar, not the spike most people assume. The reason for that comes down to simple composition. At 70% cacao, there is far less sugar in the bar, and what remains is balanced by cacao fat and cacao fiber. Both of those slow digestion significantly. The fiber delays how quickly your stomach empties. The fat slows how fast any remaining sugar reaches the absorptive surface of your small intestine. Your body simply doesn't see a sudden flood of glucose. Let me tell you about a patient I'll call Margaret. She came to my office at 64 with a fresh pre-diabetes diagnosis and an A1C of 6.1. She'd been eating 3 or 4 squares of milk chocolate every single evening after dinner for years. She called it her reward, and she felt guilty about every single piece. I didn't tell her to stop eating chocolate. I told her to switch. 2 squares of 70% dark chocolate, eaten after a dinner with protein and fiber. 3 months later, her A1C had dropped to 5.7. But what she told me that day wasn't about the number. She said she'd stopped hiding chocolate in her kitchen drawer. That matters. Research published in the American Journal of Clinical Nutrition has found that regular cacao consumption is linked to reduced cardiovascular risk. That is particularly important for you because diabetes already doubles or quadruples the risk of heart disease. A clinically supported portion sits at around 20 to 30 grams per day, 2 or 3 small squares. Now let me tell you about the label trap, because this is where many people get quietly misled. Many bars sold as dark chocolate or labeled as 70% cacao still list sugar as the very first ingredient on the back of the package. The front of the bar is marketing. The ingredient list is the truth. Flip the bar over. Cacao mass or cacao paste must be the first word on that list. If sugar appears first, the bar is not what the front label suggests, regardless of how dark it looks or how confidently it's branded. The front of the package is the salesperson. The ingredient list is the actual product. Read the product. Dark chocolate at 85% cacao or higher. At first glance, this might look like just a stronger version of number 1. It is not. The clinical evidence behind 85% and above represents a genuinely different level of support. Here's why. As cacao percentage rises, 2 things happen simultaneously. The flavonoid concentration increases substantially, and the sugar content drops from roughly 20 to 25 grams per 100 grams at 70%, down to around 10 to 14 grams at 85%. You are getting more of the beneficial compounds and less of the problematic ingredient in the very same bite. Let me walk you through the study I want every person managing diabetes to know about. A clinical trial examined chocolate at 83% cacao in 60 non-smoking patients with type 2 diabetes and high blood pressure. Participants were between 35 and 70 years old. Each person consumed 25 grams of this chocolate daily, containing 450 milligrams of flavonoids, for 8 weeks. The results were striking. Their lipid profiles improved meaningfully, and 3 of the most critical inflammatory markers in diabetes, CRP, interleukin-6, and TNF-alpha, dropped significantly. I want you to understand why this matters beyond a number on a lab report. These 3 markers are not abstract statistics. They are the driving forces of chronic low-grade inflammation, and chronic inflammation is the silent fire that keeps insulin resistance burning year after year, decade after decade. When you reduce CRP, you're not just improving a blood test. You're turning down the heat on the very mechanism sustaining your disease. You're addressing the cause, not just chasing the symptoms. There is more. Two large Swedish studies found that increasing dark chocolate consumption to at least 50 grams per week was linked to a reduction in stroke risk, both ischemic and hemorrhagic, of up to 27%. For someone over 60 living with diabetes, whose stroke risk is already significantly elevated, that is not a minor detail. That is meaningful, direct protection of the brain. I want to pause here and ask you something honestly. What was your most recent A1C reading? And has any doctor ever sat with you and truly explained how chronic inflammation is fueling your diabetes year after year? Tell me in the comments. Your answers shape what I cover on this channel every single week. Now, practically speaking, a reasonable daily portion of 85% chocolate is 20 to 25 grams, and one quiet advantage of moving to this percentage is that the flavor becomes so much more intense and so much less sweet that most people naturally stop after 1 or 2 squares. Your palate gets satisfied before the bar gets finished. I have seen patients who spent decades unable to moderate milk chocolate suddenly find that moderation with 85% felt effortless. The bar simply asks you to slow down, and in someone managing a chronic condition, consistency is far more valuable than any single perfect meal. The bar that asks you to slow down is the bar that actually helps you stay on track. 100% cacao and cacao nibs. This is the outer edge of the chocolate world. No added sugar, no added milk, no added fat beyond what naturally exists inside the cacao bean itself. This is cacao in its truest, most concentrated form. And from a glycemic standpoint, it is as safe as solid chocolate ever gets. Cacao nibs deserve their own moment here. These are simply pieces of roasted cacao bean, crushed and dried, but not refined further. Because they skip the pressing and conching steps that most processed chocolate goes through, they retain more flavonoids and more fiber than almost any bar on the market. They're crunchy, deeply bitter, and they look almost nothing like the chocolate you grew up eating. Now, let me be honest with you the way I would be in my own office. Most people cannot sit down and eat 100% chocolate as a casual treat. The bitterness is sharp and unforgiving for a palate that has known sweetness for 50 or 60 or 70 years, and I have no interest in pretending otherwise, so I don't recommend it as a snack. I recommend it as an ingredient. That is where it becomes both powerful and genuinely pleasant. A teaspoon of cacao nibs scattered across plain Greek yogurt, 10 grams of 100% chocolate melted and stirred into a spoonful of almond butter, a small handful of nibs folded into your morning oatmeal. These are quiet, simple changes, but they deliver real flavonoid content without meaningfully moving your blood sugar curve. Let me tell you about a patient I'll call Robert. He came to me at 71, 12 years into type 2 diabetes, an A1C sitting at 7.3 on metformin, and having given up chocolate entirely 5 years earlier. His numbers had never improved from that decision. Giving it up hadn't helped him. We talked about cacao nibs. He started sprinkling a teaspoon over his breakfast oatmeal every morning. 4 months later, he looked at me across the desk and said something I still remember. He said, "I can't believe something this good is actually helping me." His A1C had dropped from 7.3 to 6.8, 1 teaspoon, every morning. That was the change. Sugar-free chocolate sweetened with erythritol or stevia. I need to be very direct in this section, because this is where the food industry plays its most dishonest game with diabetic shoppers. Let me start with what actually works. Erythritol is a sugar alcohol with a glycemic index of essentially 0. It provides about 70% of the sweetness of regular sugar, but your body processes it through a completely different pathway, excreting most of it without significantly raising blood glucose or triggering an insulin response. Stevia, derived from the leaves of a plant, takes a different route to the same destination. The active compounds in stevia, the stevial glycosides, are not metabolized by your body at all. They produce no measurable glucose response whatsoever. So a chocolate bar sweetened with erythritol or stevia can deliver a flavor experience surprisingly close to the milk chocolate you remember, with almost none of the metabolic cost. But here is where you have to be careful. Many bars marketed as sugar-free in the United States, Canada, and the UK do not use erythritol or stevia. They use maltitol, and maltitol has a glycemic index of 52. That is not a low glycemic food. That is a sweetener genuinely capable of raising your blood sugar, particularly if you eat more than 1 or 2 squares. Beyond that, maltitol in older adults frequently causes uncomfortable bloating, cramping, and sudden diarrhea because it draws water into the intestine. I have had patients call me in real distress after eating a diabetic-friendly chocolate bar that was quietly sweetened with maltitol. Here is your 30-second rule for this category. Pick up the bar, flip it over, look at the sweetener listed in the ingredients. You want to see the word erythritol or stevial glycosides clearly named. If you see maltitol, isomalt, or a vague phrase like sugar alcohols without specifying which one, put the bar back on the shelf and walk away. The label that reads diabetic friendly in large confident letters on the front can be hiding an ingredient on the back that does the exact opposite of that promise. Trust the back. Never trust the front alone. Pure unsweetened cacao powder. And now we arrive at number 5. The one I told you to pay attention to from the very beginning. This is the cheapest item on the list. You can purchase a large container of it for less than the price of a single specialty chocolate bar, and it is the form of cacao with the strongest clinical evidence behind it by a meaningful margin. Let me walk you through the research that changed how I approach cacao with my own patients. A systematic review conducted by researchers at a Brazilian university, published in 2021, analyzed 7 clinical studies examining the effects of cacao flavonoids on blood glucose and serum insulin in people living with type 2 diabetes. The consolidated finding was this: dark chocolate or cacao powder at a dose of 25 to 30 grams per day showed beneficial effects on blood glucose levels and on hemoglobin A1C, along with cardiovascular protection through improved HDL cholesterol. I want you to sit with that A1C finding for a moment. A 1C is not a daily snapshot. It is the gold standard measure of how your body has managed blood sugar over 3 full months. When a dietary intervention moves that number in a meaningful direction, you are not looking at a temporary effect. You are looking at a structural change in how your body handles glucose. That is a different conversation entirely. So why does plain cacao powder outperform even the best dark chocolate bars? Because manufacturing a chocolate bar, pressing, conching, tempering, degrades a significant portion of the flavonoid content at every step. Pure natural cacao powder, the kind that has not been alkalized or Dutch processed, skips most of that loss. Think of it this way: a processed chocolate bar is like tea brewed from a bag that's already been steeped twice. There's still flavor, but the active compounds have faded. Pure cacao powder is the whole leaf, nothing extracted, nothing lost. In practice, this is the simplest of the 5 to work into daily life. A tablespoon stirred into black coffee, a spoonful blended into plain full-fat yogurt, a teaspoon warmed gently with unsweetened almond milk on the stove, a small amount folded into morning oatmeal. Every one of those choices delivers more flavonoids than a square of dark chocolate, with essentially no impact on your blood sugar curve. Let me tell you about a patient I'll call Carolyn. She came to me at 68, 5 years into type 2 diabetes, with an A1C that had been parked at exactly 7.0 for 2 consecutive years. She was taking her medication faithfully. She was walking every single day. She was doing everything right. She told me, nearly in tears, "I have tried everything." We changed one thing, just one. The sugar and creamer she'd been adding to her morning coffee became 1 tablespoon of pure cacao powder, a few drops of stevia, and unsweetened almond milk. 6 months later, her A1C was 6.5. That is not magic. That is biochemistry, working quietly every morning in a single cup of coffee. The label rule here is the simplest of all 5. The ingredient list should contain exactly 1 item: cocoa powder or cacao powder, nothing else. Avoid hot chocolate mixes, drinking chocolate blends, and any flavored cocoa product. no matter what the front of the package claims. Even products labeled reduced sugar or diet will often contain added sweeteners, modified starches, or oils that completely undermine the metabolic benefit you're looking for. One ingredient, that's all. The guilt cycle, what the research actually says. Before I close, I want to address something that almost never comes up in a clinical conversation about food and diabetes, and I think it may be the most important thing I say today. Have you ever forbidden yourself of food completely, only to find yourself eating twice as much of it later, and then spending the following week quietly punishing yourself for it? If that sounds familiar, please understand. You are not weak. You are human, and your body is responding exactly the way the research predicts it will. Studies in nutritional psychology have consistently found something that genuinely surprised me when I first encountered the data. People who feel guilty after eating tend to eat more in the hours that follow, not less. The guilt triggers a cycle: restriction, craving, rebound. And that cycle produces worse blood sugar control over time than a calm, planned, portion-controlled inclusion of the food you actually want. Picture two people sitting down after dinner with the exact same 2 squares of 85% dark chocolate. One of them knows the glycemic index is 22. She understands the flavonoids are working to improve her insulin sensitivity. She enjoys the chocolate. She finishes it. She moves on with her evening. The other believes with every bite that she is harming herself. Her cortisol rises. Her anxiety rises. By 10 o'clock, she's eaten 3 more squares she never planned to touch. Same chocolate, same body, completely different outcome. The knowledge changed the experience. The experience changed the behavior. This is what sustainable diabetes management actually looks like across years and decades. Not perfect restriction, not iron willpower. Plan the inclusion, control the portion, choose the right type. Those 3 things, repeated quietly and consistently, will beat a lifetime of guilt every single time. Let me bring all of this back to where we started. Chocolate is not forbidden because you have diabetes or prediabetes. The wrong kind of chocolate is. And the difference between the two is printed on the back of every package, waiting 30 seconds for you to read it. You now know the 5 forms that the science supports. Number 1, 70% dark chocolate. Your easiest entry point. A glycemic index of just 22. Cacao mass is the first ingredient on the label. Number 2, 85% cacao and above, where the clinical evidence shifts to actively reducing the inflammatory markers driving your diabetes forward. Number 3, 100% cacao and cacao nibs, the zero sugar form, best used as an ingredient in yogurt, oatmeal, or coffee. Number 4, sugar-free chocolate sweetened with erythritol or stevia, never maltitol. Read the back, not the front. Number 5, pure unsweetened cacao powder. 1 ingredient, the cheapest option, the strongest A1C evidence of the 5. Here is what I want you to do starting tonight. Open your pantry. Pull out every chocolate product you currently own. Flip each one over. Read the very first word in the ingredient list. If that word is sugar, set it aside. If the first word is cacao mass or cocoa mass, you can keep it. This week, pick up a container of pure, unsweetened cacao powder. Confirm the ingredient list has exactly 1 item. Start with 1 tablespoon in your morning coffee or oatmeal. Check your blood sugar 2 hours after breakfast for the first few days. Your body's response is the only data point that ultimately matters. And at your next appointment, ask your doctor a simple question. Given my current A1C, could pure cacao have a place in my nutrition plan? That is a conversation worth having. Now I want to hear from you. Of these 5 types, which one surprised you the most? And which one are you going to try first this week? Tell me in the comments below. I read every single one, and your responses genuinely guide what I cover next. If you know someone who has been carrying the weight of chocolate guilt for years, a spouse, a sibling, a friend, please send them this video. They deserve to know the truth. 1 quiet change in their morning cup could move the needle on their next A1C. If today helped you, hit the subscribe button so I can keep showing up for you each week with information you can actually trust and actually use. I'm Dr. David Aid, and what 20 years of sitting with patients has taught me above everything else is this: the right knowledge brings relief. The wrong knowledge breeds fear. I want you to walk away from this video feeling lighter, not heavier. Everything shared today is grounded in real clinical evidence, but it does not replace the conversation you have with the doctor who knows your full history and your current numbers. Please, never adjust or stop your diabetes medication based on anything you've seen online, including this video. Any change to your prescriptions must go through the physician treating you directly. I hope this week brings you steadier blood sugar and a gentler relationship with the food on your plate. Take care of yourself. I'll see you in the next one.